So before we kick off, I'd just like to acknowledge that we're meeting on the lands of, well, for most of us, the Ngunnawal people and the Ngambri people, if you're meeting here in Canberra. But otherwise, I would like to pay my respects to the traditional custodians of lands on wherever you are coming to us from today. And I'd like to acknowledge their continuing culture and contribution to the life of Canberra and the region, and of course, wherever you are, the First Nations people of your region. And I'd like to acknowledge any Aboriginal and Torres Strait Islander people who might be here with us today. And before we get started, if any of you are having particular tech issues, Darcy is one of my team members and will give us a bit of a wave. Will be here to give us some tech support. So I think I've been introducing myself as you all come in, but I'm C, and I'm the Health Literacy Officer here at Healthcare Consumers. Darcy's our Community Liaison Officer. So if you want to talk to us after the session, you'll be talking mostly with us. So good to introduce ourselves to you. Just making sure that should be everything. Use the chat function. If I miss anything in there, Darcy will flag me down. Put your hand up and we'll keep an eye on it so that we can ask questions. And there's no such thing as a silly question here. I'm always happy to slow down, re-explain things. And when I get passionate, I can speak a bit quickly. So let me know if I need to slow. And yeah, so I'll just quickly start sharing my screen so we can get started. Okay, can everyone see that?
Yep.
Excellent. Just making sure that I can see all of you as well. Fantastic. So, sounds like we've got a pretty diverse crowd, which is fantastic. It's good to have people from a few different areas here. And so we're giving a bit of a broad introduction to healthcare and health literacy. So just quickly a bit about us. We're from the Healthcare Consumers Association of the ACT, and we are the peak body for healthcare consumers. So that's anyone who uses the health system in the ACT. We do quite a big range of things these days, both educating community members through education sessions that we go out and deliver to community groups, and those are all free if you would like us to come and do those for your clients and groups. We also provide, of course, education to community workers and to the health sector is a lot of our work, advocating to make them better communicators and better at getting consumer input into the way that they work so that we can all get better outcomes. So that's the sort of thing that our whole team does. And we've existed for about 44 years, I think it was. And so pretty long-term existence here, and organizations can join us, have input on our work, that sort of thing. A bit of an overview of what we'll talk about today. Done our welcome and housekeeping. I'll talk about our aims of the session in a moment. We're going to go over what health literacy is, so breaking down sort of the academic backing, a bit of the what and why of it, why it's so important, and why we want to get more than just the health sector involved in health literacy, because it's about the whole life experience of people, who it most affects, who we might want to focus on if we're doing health activities or even just incidentally as we're doing other kinds of community work, when it tends to come up, these sort of issues in health literacy, and where. So talking about the health environment and how that plays a role in people getting good healthcare. Talk a bit about your role as community workers and where you might be able to improve things for people, where there can be some challenges in that. And then we'll talk about the safety and communication strategies in healthcare that we can use and equip our clients with. And yeah, I'll try and make sure we've got some time for questions at the end, but if we don't have too much time, you can also follow up with those by email. Before I get on to the aims, does anyone have anything in particular they want to know so I can make sure that we cover it while we're here today? Not seeing anyone jumping in, but yeah, if there's anything you want me to slow down, go over, do make sure that you flag me down. So our aims for today, and what I really want you to sort of leave with is an understanding of what health literacy is and why it's important. It comes from some pretty rigorous academic background, so I've tried to simplify it as much as possible and make it actually useful in real life. Give you some tools to recognize when someone's having trouble with their health literacy, when it might not be, they might not be getting enough information, or when they might not be understanding what's going on. Give you some tools to work out when that's happening, and help you support your clients to ask better questions and get better healthcare. And with that, I'll give you some tools and tips, and I'll follow it with a list of resources and links. Whilst we'll go over a fair bit, I'm not saying you have to use all of them, or even that all of them will be appropriate for your particular work. You can chop and change them as will be most useful for your group. Particularly those of you who are working with different multicultural communities, you might want to adapt the tools, or I'll give some links to translated versions, that sort of thing. Okay. So section 1 is the what, why, who, when, and where of health literacy. So health literacy is probably a new framework. Some of you may have heard of it before, but it's usually talked about in pretty big academic papers. It's getting better at being simplified and made more practical for people. And there's, oh, sorry, my train of thought just left me. It's really useful to understand health literacy, because once you understand the sort of framework, you can use it to support your clients to manage their health better themselves, and use that to navigate the health system better. And that'll help them get the care that they need and stay well for longer, so that they don't have illnesses for as long, or that they can manage their health better themselves. And that helps them, you know, manage their overall life better, because health plays such a huge role. So when we talk about health literacy, this is the definition we use in our own position statements. And health literacy is the combined knowledge, skills, confidence, and motivation used to make sound decisions about your health in the context of everyday life. And Pene, another one of our team members, our multicultural liaison officer. So great if any of you are working in multicultural communities, great person to talk to. We'll also be here for tech support if needed. Sorry to interrupt. With these, I sometimes also like to swap out confidence for capacity, because you might also need to consider whether someone's got the resources and support they need to activate these other aspects. So for example, a carer might need a bit of respite so that they can look after their own health for a while. So it could be that they've been prioritizing the person that they care for's doctor's appointment and health. So it's not necessarily that they don't have the knowledge and skills and motivation. It's that they don't have the capacity to go out and do those things. And that could be where your role as a support person comes in. Confidence and motivation are sometimes aspects that are missed, so I really like to emphasize them, because a person can have all this information and skills, but if they haven't got the confidence to it with the system, and that sometimes comes up where people have trauma around working with particularly authority figures, or from government experiences, which can happen with our Aboriginal and Torres Strait Islander communities, where there's some intergenerational trauma there. You can need to build confidence in people in asserting their rights and working with a system that doesn't always work with them. And motivating them can be a really big role for you as supporters of them. And a person can really be health literate in one of these areas, or an area of their life and not in others, or from day-to-day change, depending on their health conditions. So some people have fluctuating ones. Chronic fatigue is a really good example. So people can get brain fog from day to day and be really great one day, really on the ball and really organized. And then the next day, because their memory is not doing too well, that can go. So I want to stop for a second and say that if there are any of these areas that for your clients seem like they're particular problems when interacting with the health system. Does anyone want to jump in? Nellie?
I will jump in. Nobody wants to. As I said, I work with very diverse population, and we have many spouses that are foreign-born, and they have like limited knowledge of English language. So when they get adopted into the military healthcare system, we have to have translators at hand that they're comfortable with in order to be able to serve them better. And besides the translation part, also differences in healthcare systems poses another challenge, because they are used to the way that Japanese healthcare system operates, and this is not the way anything operates in the American, specifically American healthcare system made for the military. The referral processes, everything from invoicing and documentation to referrals to what yields, for example, do you need a blood test? What kind of blood test you need? So with that being said, it's like health literacy, being able to educate our patients, being able to understand their needs. It's a great challenge.
Yeah, and it can be quite complicated. And it sounds like they're not necessarily lacking in, say, the motivation component here, but the knowledge isn't there, and the environment's not necessarily supportive. And for those of us here in the ACT, we've heard similar from like Companion House for migrants and refugees when they first come here, because the Australian system is quite different to most other countries in the way it works. For example, understanding that the way our public system works and Medicare, and how not everyone's eligible for Medicare, even though a lot of our health materials are written for people who are eligible for Medicare. Those sort of things can be really complicated. And then you add the layer of language on that. But it's not necessarily that people aren't motivated, and they might have a lot of skills around advocating for themselves once they understand that. So that's why we break it down into these components. Another area that we talk about when it comes to health literacy, and we kind of roll it into it, but it's a little bit separate, is health numeracy, which when you're at school, you might have heard literacy and numeracy, which is your numbers, your math skills. And health numeracy is that sort of quantitative maths information where people get a lot of numbers in their health information. So it could be, like I've got on the screen, the nutrition information. How do people understand that so they can be eating well and keeping their health up that way? How do people understand risk? So you might be given a percentage of people who get a certain side effect, but is a percentage really that useful? I've had health appointments which were way more helpful when someone went, well, it's 1 in 10 people, and said it was people rather than a percentage. Even things like reading scales and understanding differences between units, or being able to measure out your medications. And then there can be barriers too. Things like health numeracy that are a little different to health literacy. So those can be that people are intimidated by maths or not that good with it. Labels are hard to read. That's particularly a problem with medication labels, which are only just starting to be standardized. But even things like physical issues, I get arthritis in my hands, and some medicines are really hard to physically measure out, even if I can work out the correct dosage. So those are the sorts of things that we might think about around numeracy. Are there any other sort of barriers you might think about when it comes to the health numeracy issues? Anyone? Right, dwell too much on that one then. And so we've done the what, that's sort of thing that we are talking about here. The why of it and the reasons why it's important is that low health literacy makes it harder to do things like follow a good diet, understand how much people should exercise, know which health services can help them. So people might turn up at a health service, assuming they can get help, get in there and be told there's nothing they can do. And that's really disappointing. It makes people reluctant to go back and seek help, and they might just leave their health issues until they've gotten a lot worse. It makes it hard for people to understand instructions for things like taking medicines, and medicines are a really big area where a lot of people, particularly older people, up to a third of unnecessarily hospital admissions are medication mistakes. So it's really important that people are able to understand instructions, well, it's important that both they can understand those instructions, but they're explained well. So whilst I'm training you so you can support people find the information, we also need to talk to health services about doing that better. It's also things like organising their healthcare appointments, figuring out that risk and benefit, which is where that numeracy can come in, and also things like filling in forms. And all of this isn't just within the health system, because mistakes around your health can mean that you have to pay more. It means that you spend more time off work, and that can impact all sorts of things, your finances. It can impact your housing because of those flow-on effects around your work and your finances, those sorts of issues. So if we look at the bigger picture of people's lives, it's important to think of these. Some other ones here, yes, mismanaging medication, not getting vaccines, which I think all of us are familiar with over the past few years, not understanding their own diseases and conditions, so they can't manage them. They might be in pain unnecessarily, those sort of things. And who's affected by this? Well, in the ACT, we're comparatively doing fairly well. In the rest of the country, it's about 60% of people, and this is from the Australian Bureau of Statistics, find it difficult to do everyday health tasks. And that's defined by the ABS, the Bureau of Statistics, as they can't calculate the dose of an over-the-counter medication. So not even a prescription one. That would be something that you can get from any pharmacy or even a supermarket, which is a bit concerning. They can't make decisions around their health. So they might be offered a couple of options by their doctor and they don't understand how to make a choice between them. They might not be able to organize their appointments and those other things that I listed. They might not be able to find information online and work out whether it's reputable or not. So in the ACT, it's about 44%, and that's probably linked to the fact that we tend to have a more educated population and a slightly wealthier population, but 44% of people is still pretty high. So there's a fair few people that might need help in this. And it tends to affect adults who, for whatever reason, have limited literacy and numeracy skills themselves, people working in lower paid or lower skilled jobs, people without those sort of post-school university or TAFE qualifications, and people that have these sort of difficulties, we know from research are more likely to have poor health outcomes. So I just wanted to stop for a moment and see if any of you have noticed particular difficulties with your clients or any of your client groups around when they're trying to work with the health system. What sort of difficulties are they having? Or have you heard any particular complaints about the health system from your clients? We can try and put that health literacy lens on it. Anyone? Also happy to hear anecdotes from your own lives. Michael?
Hi. Yeah, so I work in the mental health space, and basically, the most common feature is just like, access to services because of the financial barriers. So especially, like people say that, they get assessed for, psychiatric assessments. And then basically once they get a label, they were like, they feel like they were just like dumped in the system, like in the community, but actually not have services available for them as free. And as a result, people, tend to associate that experience as a really bad experience, which affects their help-seeking behavior.
Absolutely. And so they haven't really been given the knowledge, the information they need to navigate what is a very complex system. Certainly mental health is quite a beast to navigate. So yeah, that's a perfect example of where health literacy, and it's not all on them individually, it's the system not providing that information in a lot of cases. So it's both sides here. Sienna, you've got your hand up.
Hi, can you hear me?
Yep.
Awesome. So I'm actually from Dallas, Texas. I work as a community health worker within a pediatric healthcare system here. And something that I hear a lot from the parents is, especially families who come from lower income communities and, have limited access to all the things that it takes to get quality health care. They tell me a lot that they feel like whenever their children are given a diagnosis, they feel sometimes like the provider is blaming them for that diagnosis. So whether it's like diabetes or obesity, or maybe the child is underweight or what have you, a lot of times parents will tell me that their provider was really insensitive or made them feel like they were to blame for their child's condition, when really that provider is not taking into account their social determinants of health.
Absolutely. And I mean, at the moment thus far, we've mostly talked about individual health literacy. I'll talk a bit more about the health literacy environment in a moment, but the attitudes of health providers is certainly, it plays a role here too, because that attitude is going to impact their confidence, their motivation to keep looking for good healthcare, especially when there's those income barriers. It can, if people aren't confident, and it impacts that feeling of, adds to that feeling of sort of hopelessness against a system that's really hard to deal with. It's going to make it harder for them to manage those health issues, particularly for kids, where you're both managing, I mean, the parents have got to manage their own health and their kids' health here. So you can see how these sort of accumulate.
Yes.
Yeah, so great examples there. So now those are some really good examples, and they do also highlight some of the issues here. So I want to emphasize that all of us do have low health literacy at some point, but there are some groups that are at most risk of having low health literacy. It changes over time. As I said, it can fluctuate with conditions, if you get bad news, that sort of thing. But older people, people from lower socioeconomic brackets, so who have those income barriers, here in Australia, Aboriginal and Torres Strait Islander people, but of course in the US, Indigenous Americans do also experience barriers there. Culturally and linguistically diverse people, and another layer, migrants and refugees have their own barriers. LGBTQIA folks, carers as well. All of these groups will have an increased risk of having low health literacy for one reason or another. So whether that's because they've experienced discrimination in the past and that makes them less motivated or less confident, or so I used the example of the carer earlier, they might have just limited support and resources to manage health appointments, and they might be prioritizing the person they care for and their conditions. Let's pick another example. When we've got that we've got people who live rural and remote, then getting to an appointment requires a lot more logistical know-how, and they might not have the skills at hand to keep track of all of that. And then, yeah, if people are coming from lower socioeconomic brackets, they might not have the literacy and education the same as someone who's lived a fairly privileged life. And so navigating a really complex system is going to be more of a barrier. And then, of course, we run into languages and translations and all these things that aren't always there. But all of us will experience low health literacy at some point. When you're sick, when you're unwell, when you're in distress, or you've been given bad news, that's the point which most of us will experience low health literacy and be most familiar with. But there are other groups that are at more risk. And what I like to say is health literacy is a state, not a trait. It's something we experience. It's not something that's inherent. We all have it sometimes. And the important thing about this is that you can flip it on its head and say, well, that means we can change it. We can help people and provide support to improve that. So the first thing we can do is to recognize when people are having low health literacy. So when people are having low health literacy, and these are things that you kind of have to look at holistically, you know your clients best, is you might hear them doing things like making excuses. So someone might say, if they're really actually having trouble reading written information, they might say something like, I've forgotten my glasses, I'll read it when I get home, or let me take it home to discuss with my partner or my children. And that could just be that they're embarrassed. They don't want to say that they can't understand the written information in front of them. They could be using humor to deflect, that sort of thing. There could be perceived resistance to instructions. Some of us I've worked in the mental health space as well myself, and you sometimes hear about non-compliance, particularly in that system, and that can be a bit of a punitive attitude towards people. And when someone is getting frustrated, they don't want to listen, they're not following instructions, that might just be a sign that they're not understanding. They need something explained more to them. They need a bit more support to follow what is being asked of them. That might help them. Someone who has no questions, it could be that they understand everything, or it could be that they're so overwhelmed by the information in front of them. It could be missed appointments because they're having trouble keeping organized. It could be medication errors and interactions. So these are the sorts of behaviors that you might look for. And if they're forming a pattern, that might mean that they need some help. Can any of you think of some others that you might have noticed in clients when they're having a bit of trouble with the health system? Michael?
One thing that I noticed is that for people that have like history of trauma, they tend to exhibit like what do you call this? Treatment interfering behaviors, because they're not actually ready to engage with it. With the program. Yeah.
Yeah, that's a really good example. It's that one of the reasons I put folks who've experienced trauma on that list is because, yeah, that can impact people's motivation. They're just not ready to engage with treatment. And if clinicians, if the health system hasn't factored that in, that can cause issues. So that's something to consider. And one thing to really remember is that healthcare can be demanding, that people really just want to see a healthcare professional and do better. And the health system's expecting a huge list of things. So I've jotted down what we could think of, keeping appointments, remembering their medical history, bringing a list of medications. If they're getting discharge instructions, keeping all of those in order, paying bills on time, and paying them correctly, especially if they're processing insurance claims, that sort of thing. And the demands on patients have really tipped, so that we're demanding more and more of patients to manage that communication between their healthcare professionals. And that's where a lot of error comes in. And it's not necessarily the patient that's miscommunicated, that they're being expected to catch those problems. And if we've got issues with health literacy, how are they supposed to also catch the communication issues there? So one of the things we can do here is increase the sort of communication strategies and skills of our clients so that they have a better opportunity to do that. And so last on our list for this section is the where. So the health environment, we might just be thinking of doctors' offices, we might just be thinking of hospitals, but it's a bit broader than that. This is the whole side of the health system that is feeding into what our clients know, what skills they have and what they're being provided with from that side. So it's how buildings are set up, even how they look. So if a building looks really kind of oppressive, not very welcoming, that can really hit people's confidence, especially if they've if it looks like a bit like a prison, they're going to go in feeling a bit nervous. It's going to impact their willingness to engage with that. More welcoming buildings do make people feel more comfortable, that sort of thing. Then there's things like policies and processes that consider part of the environment. Have they been written so that clinicians understand they need to consider people's language needs, that they need to get an interpreter in? Do clinicians have the processes there so that they can meet people's access needs and they've got the resources behind them for that? Do the signs and maps in buildings, and particularly hospitals, it tends to be an issue, are they easy to navigate? Are they understandable? Are there translated versions if there's quite a few people who speak different languages? Same with things like handouts and letters. Is there all the information you need to get there for an appointment? Because you can't expect someone to turn up on time. It's really hard to get that information. And this all goes for websites. Is there misinformation in the media? That's going to impact that. And then it comes down to how staff and consumers interact. So that's where we get things like some of the discrimination and attitudes that we were talking about earlier. And so those components all work together. We have the individual sort of skills, knowledge, confidence, motivation, and then I always add support here, and that's where you folks come in. And then we also have that health literacy environment, which is all those factors about how people get their information, how easy is it to understand, and comes together for their understanding of that of the information about healthcare. And barriers and enablers to health literacy exist on both sides of that partnership. So while I work with the health system and health workers to make that better from their side, also work with consumers to make it better, and your work is part of that. It also does mean that as a community worker, it can be really important for you to give feedback on how your clients work with the system. And that might be just putting in feedback to a consultation process, that sort of thing, which you can do with us. We all often consult with community orgs. Okay, so that's the first section that we're doing here. And we'll go into what your role is in this system, and we will have a break after this section, which is a fairly short one. So this is a model that came out of one of a big study into healthy aging in Europe. And down the bottom, we've got these health literacy interventions. And we're talking about the three on the bottom left here, which are community support, empowerment of persons with low health literacy, and communication between clients and professionals. And that's sort of where your role as community workers fits in this whole system. Because yeah, if we can support individuals on this side of things and facilitate some better communication between them and their professionals, we'll get those better health literacy outcomes. So community support, that could be identifying where they need support outside the health system. So that could be the carer who needs some respite so they've got time to organise and get to their own health appointments, look after their health, go out to the gym, those sorts of things, which are really practical. But it could also be organising education sessions for your client group on health, empowering persons with low health literacy. That could be providing them with the tools that I'll show you later. So the fact sheets on things like trusted health websites, so people can work out if the things that they're looking at online are really that trustworthy, giving them information about their healthcare rights, which is a fairly light touch way to say you have rights in the health system and this is what they are. It could be being a bit of an emotional support person to help them find their own empowerment in the health system. So reassuring them they've got rights, they should ask questions, those sorts of things. And then with that communication between clients and health professionals, yeah, it could be equipping them with those tools. It could be practicing asking questions, might be running workshops to build people's confidence. And again, that providing emotional support. Or again, it really depends. The roles do vary a lot in this sector. It could be working with health staff that work with your particular client group and talking about their needs. So those are the sorts of things. If anyone's interested, I can send out information about how the ABS looks at health literacy, and they have some really useful questions that you could be asking to help work out what your client group needs. I'm seeing a thumbs up. I'll include them in the email afterwards. So let's break down your role with that framework that we started with. So we can think about it with those 4 categories. So knowledge, skills, confidence, and motivation. So what does my client know or need to know? What do they do currently and what do they need to do? Are they confident or not confident, and maybe why? And their motivation. Do they want to or not want to? And those of you who might have done some behavior change work, so I know as part of my community certificate, I had to do some smoking cessation work, and that was a big part of it. But that's the motivation stuff may well come into some of your work. So how do you currently identify what your clients know or do, or how they have confidence and motivation to participate in your current work? I'd be really keen to hear. But don't be shy. I'm sure that you've done some of this.
We need to give information that's meaningful to the patient and deliver in a way that they can actually apply it to themselves.
Mhm.
So I review a lot of written patient information. It's always written health professional to health professional, not what information does this person need
Yeah.
to take away.
Yeah, so that's a prime example. And so Lisa, how do you find out what information that person needs from what's being given to them?
When our staff rewrite patient information, they have to consult with consumers. They give their information, the written piece of information, to consumers, and then they get feedback from the consumers. And then we do an assessment on it to see, does it meet health literacy universal precautions, as in the reading age, are the key points easily identifiable? If I read through it and I go, well, I'm confused and I'm a healthcare worker, I actually go out and source some other consumers and give them permission to be honest with their feedback. Because one of the other challenges that we find is if you ask your service users to make a comment on a piece of information that the service providers are given, consumers often will just go, yes, that reads really well, when it doesn't, because they're worried about what might happen if they say, I didn't understand it.
Well, that's a really good point to raise here, is that whether they're comfortable giving that feedback. That's really useful to flag as well. And I like that you've raised the universal precautions there, because we include that on the Canberra Health Literacy website as well as recommended for health services. Has anyone else got an example in one of your current programs? Michael?
Was the question about like how do we determine what information the client needs?
Well, how do you determine in your current programs, it doesn't have to be a health one, what your client needs to know or needs to do to participate in your current work?
Yeah, so what I do with them is like initially when they're referred to our service, we do an intake and assessment, and then along, like when we start doing the support sessions, we dig deeper on what their needs are. So we use like a tool called the Needs and Support Planning tool, which identifies like all the areas in their lives that they might have concerns with. And then if they say that they have like a high level of concern or a low level of concern in a certain item, we describe the need that they have for that. And then if we identify that they might benefit from some kind of like psychoeducation or any kinds of education, or if they need to engage with services, then we do like some kind of problem identification, prioritization, and then goal planning.
So you've got a bit of a structured approach to working out their existing sort of needs and blocks, what supports they need or can use.
Yeah, because sometimes when you get the referrals as well, they're not really complete information. It was just about like satisfying the requirements or the suitability or eligibility for the program. So we have to do our work and then dig deeper.
Absolutely. And that's a pretty common issue. So that's exactly what you should be doing. And to put the health literacy lens on it, you're going and finding out what your client's current knowledge is and identifying where some gaps might be using what you've got. So you're already doing some of this work. And that's really the point of what I'm asking, is that you're already practicing some of what we're talking about today, and certainly probably identifying a few of their existing skills and supports, that sort of thing. So you can work through that with them. So what I'm trying to emphasize here really is that all of you are probably already doing some of this, particularly if you are doing things like intake forms and identifying people's needs. The other question I've got on here is, in your current work, are there gaps, and what feedback could you give the health system around how they assess these needs that could be better? And that's not anything for right now, but it's something you might want to think about in the future for improving that health environment. Okay. So I'm going to finish off this section and then we'll have a bit of a break, which is with a case study. So the case study that we've got here is a young woman, I've called her Lucy, is a 20-year-old woman who has limited experience of the health system, and she thinks she's got endometriosis. So for those of you who don't know, it's a pelvic pain condition that can really interrupt people's work. So it can have a significant impact on your life. So having a lot of pain, might be having a lot of time off work, that sort of thing. Goes to a GP and they refer her to a specialist, and they're adamant this is the right specialist. So Lucy, of course, believes them, hasn't got much experience with the health system, so goes, okay. At the appointment, GP asks her a few questions and says, do you want to go private or public? And so for the non-Australians in the system here, I can explain that if you need that in the this call here. Apologies, my words are going. And Lucy here doesn't know the difference. She says private because she doesn't want to be treated in public. That sounds a bit invasive. She gets asked, do you want a hard copy or an email of the referral? So she's not sure. And the doctor just prints one off because that's just how they usually do it. So didn't really know what to say. She didn't understand the difference, why she might want to back up or something like that. The GP doesn't mention that there might be costs with going private. And she didn't know that she was about to be hit with that specialist appointment cost because she didn't know to ask. So she's probably going to be hit with a few $100s. And the letter is written in a lot of medical language. So while she's got a copy and she can read it in front of her, it's written in medical language, it uses acronyms, and there's some letters that seem to refer to her in her case, but she can't work out what the next step is. And she doesn't really feel confident phoning the specialist because she doesn't understand what the letter says. So she comes to you for help. Say you might be working at the local youth centre and she comes to you to ask for a hand. So what I want to try and do with that is put that sort of knowledge, skills, confidence, and motivation framework over it. What might we do to improve her knowledge, her skills, her confidence, and maybe motivate her to take those next steps as a community worker? So I'll give you a couple of minutes to think about it, and feel free to pop your thoughts in the chat or stick your hand up and we'll have a chat. And do ask if I haven't explained that well. Has anyone got any thoughts on this one? Michael?
Well, to be honest, like, I'm not really sure if this has been done or not, but you know, firstly, it says here that the 20-year-old woman with limited experience of the health system thinks she has endometriosis. So, you know, assuming that the GP actually did an exam or assessment of why she thinks she has endometriosis, would affect like my approach to this.
Mhm.
Because you know, like seeing a GP here in Australia is kind of like difficult. I mean, like it's very limited time, you know, like you only have like less than 15 minutes. And then if you go to like a super clinic, if you say to them, oh, I have this, then they just like treat it like right away without actually doing some more like digging and assessment. So that's one thing that I would ask her, whether, you know, why did she think that it was endometriosis and whether this was explored. Yeah, during the GP appointment. That was like my main thing for it.
Mm. Yeah, and I mean, one of the things we need to be careful of is that, yeah, we don't want to necessarily be giving health advice, but it's worth, yeah, encouraging them to make sure they've asked questions, because yeah, she's got limited experience with the health system and may have just assumed that 15-minute GP appointment asked all the right questions.
Exactly. And in the mental health sphere again, you know, like people get labeled with like different things a lot every time, you know, there's like an assessment. So people would end up getting like really confused of what they are. And then some people would identify to their diseases or to their illnesses, which kind of like limits their way of like interacting with people or just like with the system. So yeah, that's why I thought that it was important to note that.
Mm. Yeah, so in terms of knowledge, you might be saying, well, in future, you could ask more questions if you want to think about questions now, and we'll talk about tools that you could provide to her that are evidence-based, so that it's not, you're not necessarily stepping over your boundaries. That way she's more equipped to ask those questions next time, that sort of thing.
So you're saying that she's came into a community organisation after she's had a diagnosis as well. So, I mean, you probably did the process of intake and assessment, and then I would probably get some consent. I mean, because of the people that I work with, I have to sort of sometimes talk to doctors and a whole range of people as well to make sure that they're getting the medical service that they need. So I think it would be, you know, if you've got a health person there who can explain the referral to her and about private and public, the cost of probably going to the specialist as well, because I mean, she's only 20 and her experience of the health services, it would be really limited. So it'd be like, you know, do you know that this will be this much today and you go to the specialist? Do you have private health cover? Do you have Medicare? All that sort of stuff. So I think that making sure that you've got a lot of consent so that you could work with them in a much more holistic way.
Mm-hmm. Yeah, so depending on your work setting, yeah, you might have access to someone who, of course, yeah, providing that consent, who can provide that knowledge in a bit more of a thorough manner. Yep. Absolutely. So yeah, connecting with a service that can provide that knowledge in a bit more of a holistic manner is a really good idea. Anyone else?
We have some good examples in the chat of what to do in this situation. So we've got Lisa mentioning asking, understanding, to check that the consumer understands what they need to do. So ask her if she could step through the information she's been given. So using the talkback method and checking that directly from the consumer that you've got an understanding from them.
Excellent. And I also see Zane's now. So would Lucy like knowledge about navigating GPs in a small amount of time, support around this referral? How does she feel about the process? What would make her feel more empowered? So, and those are some really good ones there, Zane, about, yeah, about your does she want the knowledge? Does she need support to around that specialist referral, and how she's feeling about that process and feeling more empowered is looking at that confidence and motivation aspect. So that's a really good one too. So that's really useful. And what I'll encourage you all to do, and if we have time, we'll come back and have a look at this example once we've gone through the tools, so that we can examine it a bit more. And I will flag that with this example, motivation doesn't seem to be the issue here. And it's, sorry to throw in a little bit of a curveball, but this is one of those examples where motivation isn't the problem. It's all these other aspects that might be the issue for Lucy. So we'll stop here, and just for time's sake, we'll take a 10-minute break. So I think we'll come back by my time, it's 2:07, so 10 minutes from now. So turn your camera, well, most of you have got your cameras off. I'll turn my camera off too. Take a leg stretch, and we'll be back in 10 minutes. All right.
Before we go, see, can I just check with Michael whether their hand is still up for a reason, or is that okay, it's gone now.
Right. Okay. So I'll see you back here in 10 minutes. All right. Well, I will reshare my screen. Okay. And I can still see all of you. Excellent. So this next section, we will be talking about safety and communication in healthcare, because the goal of talking about health literacy is to improve safety and health outcomes using good communication. That's what we're really here for. So first up, I want to talk a little bit about the risks in the healthcare system that we hear about and have been pretty well studied. So these stats come from the World Health Organization. So they apply pretty broadly in sort of Western health systems, and the stats relevant to countries with higher incomes are that about 1 in 10 patients in hospital care experience some kind of avoidable experience some kind of harm while they're in hospital, and about 50% of those are avoidable. And when I'm talking about those sort of harms, we're really talking about things like medication errors, avoidable infections. It could be, other hospital-acquired infections, not always avoidable. It can be issues with being moved between departments, those sorts of things. And it actually increases in primary care, which is your GPs, and outpatient care. So about 4 in 10 patients will experience some kind of harm from the health system. About 80% of that is avoidable. So again, it's those accidents around medication errors, issues with transfer. And when we're talking about harm, we're talking about physical, emotional, or financial harm. And so physical harm is, of course, medication errors, injuries, infections. Emotional harm is where what we talked about earlier with those attitudes towards parents of kids, well, that can cause people some pretty bad emotional harm if they're basically being told that they've harmed their kids. And financial harm, so people who are spending money unnecessarily on medical appointments, going into debt, those sorts of things, because they haven't got the health literacy to ask about financial consent if they're going in for a big appointment, those sorts of things, where they might be getting charged more than they need to because they don't understand the system. They might be getting a test that's unnecessary, a procedure that's unnecessary, or they could have gone a different way that would have suited them better financially or lifestyle-wise. And the solution to most of these is to engage patients in their own care. Some of the reasons that we get these issues would be that the health care systems are simply getting more overloaded, and a lot of us are very familiar with these issues through COVID. certainly at the hospital end, but our GPs are also really hard to get into, their time stretched, so that increases errors. The self-care demands on our clients increase. So you remember that slide earlier that I showed you with that huge list of things the health system expects of our clients? Well, that means that there are just more room for error. Hospital stays tend to be getting shorter, and part of that reason is to avoid hospital-acquired infections, but it also means that there's a bit of pressure to get people home before they might be totally ready. And the average number of medications has increased that people are on, particularly older people, and that can increase the risk of side effects, interactions. More people are experiencing chronic disease. In the ACT, we have a pretty high proportion of people with a chronic illness, and that's also a factor in these. So if your chronic illnesses aren't fully considered in your treatment, that can cause an injury. And of course, then we have the patient factors, and they might not be confident in speaking up about an issue or when they think there might be a medication problem. And it's not just patients themselves, but also their carers who need to have the skills to say, I'm not sure that's right. And those sort of health literacy issues have a big role to play here. So all of this is based on good communication. I'd like to stop and just see if any of you have some examples of harm that might have come from the health system because of either clients' low health literacy or because of that environmental factor. So where the health system hasn't communicated well with a client. Just keep in mind, of course, privacy of any of the clients. Has anyone got a good example? I don't have any volunteers here. Just pulling one from my own experience. This person that I was advocating for in a volunteer capacity went into hospital and was really unwell and couldn't communicate very well. And they were on quite a lot of medications. Their medication list hadn't been updated in the Canberra Health Services system. And because they were so unwell, they weren't really asked about their medicines. It was assumed that the list that their GP had forwarded was up to date, and it didn't list one of the antidepressants they were on. And so they were given another medication. They had a really bad reaction. They ended up staying in hospital twice as long as they needed to because of that. So that was a direct example of harm. So those are the sorts of things we're thinking about because no one checked with them. That communication simply wasn't there. Even though they were quite unwell, they could have been supported to check that, those sorts of things. So your role in these sorts of scenarios is knowing, you probably know some of your clients pretty well and know their strengths and difficulties in communication. So the complexity of the health system means that you might be able to help them understand where they might need some support or help them find skills and knowledge so that when they go into the health system, they've got a bit more of those skills to prevent these errors. They might have a bit more in their pocket. So for example, in my work, I might provide people with templates so that they can have a good record of a medical history and all their medications with them when they go in so that they can avoid those sort of medicine errors. I might also provide them with a wallet card with questions they can ask when they go into an appointment so that even if they haven't completely prepared for their appointment, they've always got some questions that they can ask about risks, procedures, those sorts of things. One of the other things that we can do is share with people their healthcare rights. So here in Australia, every healthcare setting, so doctors, GPs, allied health, any of them, they have to comply with the Australian Charter of Healthcare Rights. And these are rights that anyone can expect in healthcare if they're using the system, and that's whether they're Medicare eligible or not, whether they're just visiting Australia, these apply. And so that's 7 rights, and I'll take you through all of them now, but I will also include a link on your resource sheet that takes you to a bunch of resources that explain these, translate them so that people understand them. Oh, sorry, not that one. And so the first one is access, and access is both equitable access in terms of things like translations, the right to an interpreter, the right to physical access for people with disabilities, the right to using a support person if you need it. So really important to reinforce that one, particularly the one around interpreters, because not enough people know that they're entitled to a free interpreter at medical appointments. The right to safety, so that people have a right not only to have safety protocols followed, but the right to feel safe in healthcare. And that includes emotional safety as well as their physical safety. The right to respect. So for, say, our LGBTIQ community, that means that things like using their chosen name and pronouns, they have a right to that sort of respect from their health services. Partnership is one that we work with a lot, and that's that consumers have a right to being partners in their care. And that's where asking questions, having a say in your treatment is a really key one. So you are an equal partner in your care with your doctor. And another one to think about here is a concept called the triangle of care, which is where someone has a carer, the carer has a right to be included in that, of course, with the consumer's consent. That doctors do need to include them to make sure that that consumer has enough support. And that sometimes isn't always done, particularly around the point of discharge. The right to information, which is again when we get to things like translation, making sure things are in plain English, and that you can ask for someone to re-explain something without medical jargon, or provide something as a video, demonstrating how to take a medicine, that sort of thing. Privacy, we talked about getting consent from people, making sure it's informed. Privacy is a really big one there, and the right to give feedback. And making sure that people know that they can give feedback and they have a right to not experience retaliation for that. It's a really big one. And it's not just complaints, also positive feedbacks are really helpful for telling health services when they get it right. But earlier this year, we put out a complaints guide to help people know where they can give feedback and different kinds of feedback, because if people want to keep it more informal, so they feel a bit safer about it, because anonymous feedback is one of those ways people can feel safer, we want to make sure they've got that sort of information. So this is one tool you can share with people and make sure they understand their rights. These have come from the same place, the Australian Commission on Safety and Quality in Healthcare, which is a government body. They also put out the top tips for safe healthcare. And the top tips are really useful. They come as a booklet, and you can probably pick these up and distribute them. We have boxes of them at our office if you'd like some for your clients. And they have, I think it's 9 tips that are useful for your clients to have a look at and to follow. Number 1 is ask questions, and I'll go into a bit more detail about some different tools, question builders, and some little lists of questions to help people ask good questions in healthcare. Finding good quality health information that's reliable, and the Commission has further guides on this that we help create with consumers, so that they can figure out which information comes from a reputable source that's actually relevant to their lives, so that they're not just getting something off Reddit and following that sort of thing. And I'll include a link to our trusted health information fact sheet, which gives that sort of information, links to things like health translations, which has that sort of reputable information in multiple languages. The next tip is around understanding the risks and benefits of medical tests, treatments, and procedures. And that's, of course, not as easy as that sentence makes it sound. And I'll show you the Choosing Wisely 5 questions, which is about asking about risk and getting it explained to you in simple language, so that you can understand what the costs might be, what the alternatives might be fully. And number 4 is keeping a list of all the medicines you are taking, because again, that's one of the most common errors and common areas of harm that happens in the health system. Number 5 is about confirming what will happen before a procedure or operation. And we can use Question Builder for that, but that's also where I'll talk a little bit later about a technique called check back, where clinicians are taught to sort of get consumers to explain what's being done to them, but consumers, where a clinician doesn't do that, can prompt them and go, can I just explain to you what I've understood and get you to check that I've understood? And that's a really good idea for this one. We've also got number 6, asking about your care when you leave hospital. And this is a really important one for carers to know about, making sure that they understand the discharge procedures, that people have got all the information they need to refer them out into the community settings. Knowing your rights. So that's why I've talked about that set of rights from the Commission itself. Understanding your privacy and accessing your medical records. Some of you would remember when the federal government My Health Record came in, there was a lot of concern about privacy. So people understanding that they have a right to things like opting out of My Health Record. They do have choices about who shares their health information, and that they have to give informed consent about their medical information being shared. And making sure that people give feedback about when things are not only not going so well, because that improves safety, but also giving feedback about when things have been done well, because that will help health services have examples of when they've done really well that they can share with other parts of services, for example. So what you can do with these is encourage clients to understand these top tips. So that's why we've got the resources available. Do things like say that they don't understand the information that's given to them, especially when we're talking about those risk factors or what procedures are being done, and support them to ask those questions, encourage them to keep asking questions. You can help them ask for information to be presented in a different way, give them some prompts or some scripts is a really useful way to do it. And one thing that they can ask is for telling professionals to give them more time to make a decision. Okay. So really what I encourage you to do with this sort of information is introduce it to your clients and all your community members and reinforce it with them that these top tips are really important in healthcare settings and knowing their rights are. So if you'd like any hard copies, we can make that happen. I'd really be keen to hear from you, because you come from quite a few different groups, how you'd introduce this sort of information with your clients, because we can send it out as many times as we like, but you're on the ground. So how might you introduce it? A bit of a quiet bunch after the break. So one thing I've seen is just having the flyers on hand if you've got an office or something that people can drop into. So certainly having the top tips brochures around is really useful for people. Having your healthcare rights on display in various healthcare settings, especially for those of you who might have a healthcare service attached to your community service. That's another way of sort of setting the expectation that people have their rights. So, okay. Before I jump into the next bit, I wanted to have a bit of a discussion with you all about what the barriers are to good communication in healthcare that you've seen. So I really encourage you to jump in from your own experience, from professional or your own life. What sort of barriers to good communication have you come across? Sienna.
Yes, so the most obvious one would be like language barriers or difference in language. But Something that I think I've noticed as a barrier to communication is somebody who may have already had a negative experience with some facet of the healthcare system. And so even though they may be there to receive care, they may already have a barrier up and may not be as receptive to what providers are telling them, because in the past, that trust or that respect has been broken. And so they're not as receptive and not as responsive.
Yeah, absolutely. It's one of the reasons why confidence is such an important one, and why, of course, respect is one of those rights. Because if we don't have that, then people won't engage with services, and that's a huge barrier to communication. Using jargon and acronyms, we've got from Rosemary in the chat. Absolutely. And a lot of clinicians can be really hard for them to realize when they're using jargon and acronyms. I was part of a society at uni where we used to have someone sitting at the back of talks by professionals with a little monster puppet. They would hold it up and be like, it's the jargon monster whenever you use a term, because people just don't realize until they're really practiced. And some barriers, so people don't feel represented. So Zane, again, with a really good response. Some barriers are people don't feel represented in communications campaigns and feel excluded and don't want to engage with the service that isn't targeting them. That's a really good one. And of course, Meridian being the LGBTIQ sort of peak in the ACT, you're targeting that community. But one of the things that we tend to remind health services of is have some visible pride stuff in your waiting rooms so that people know that this is a service that is safe. Because it can't just be assumed in health settings. Same with having things like the translating and interpreting service icons, is you need to have those universally used icons around so people know I can get an interpreter here. They can make that connection. Some of the multicultural services will have the different flags up so that people can realize this is a service where I'm thought of. So that's a big one. Yeah. I thought as well. Yeah, cultural and religious beliefs. Absolutely, Nelly. It's got to be culturally safe for people, and certainly religious beliefs. We've just been giving feedback on things like the spiritual care program at the hospital, and that can be a factor for people in engaging in services. Certainly, I mean, for people staying in hospitals, if there's not a prayer room available when they need it, that might be a factor in whether they go in or not. So these can all be barriers to getting people into services and also to communication if they can't be communicated with sensitively. Some of the other ones that we come across are lack of time. Oh, there you go, Oris. You and I are on the same page here, feeling rushed. Yeah, especially, yeah, you get those GP appointments that are 5-10 minutes and you got to go really fast. And so that's one of the reasons why we emphasize preparing, make sure you've got your questions there. The power imbalance between consumers and professionals, particularly if you come from one of those marginalized sort of communities, that power imbalance can feel really big when you're trying to assert your rights. And that's where our support for our clients can be really important. Oh, yeah, Nelly, that's a really good point. So a good example of the cultural and religious values is in Japan, people refuse heart surgery because the system uses pig heart valves, and that doesn't work for some people. Or that's against those beliefs. And yeah, Sienna, personally have felt rushed by a provider. I certainly have too. We also do have barriers like clients' pain and anxiety. That makes it hard to get through things. Might notice I'm having a bit of trouble talking. That's just as I get through these presentations, I get a bit tired because of my own health conditions. It also happens in doctor's appointments. And so we have to find strategies to support people through that. So I have notes and I do the same for doctor's appointments. Complexity of illnesses can be a factor. And then, of course, we have aspects like disability. So if any of you are working in the disability support space, it might be providing communication aids. that sort of thing. Misunderstandings, so people use language differently in different contexts. Health professionals can have a real attitude around people using Google to do their own research, for even if they use very reputable sources. Assuming gender and sexuality is a good one. So we've got some really good thoughts here about the barriers to communication. And some of the ways that we can get over that are, hey, making sure people know their rights and can assert them. But also we do systemic advocacy from our side. You can provide support to people and help them understand that they've got options when they encounter these in healthcare, and can do things like make complaints, give feedback. And then when we have those barriers to communication, one of the things that I like to do, particularly when people are rushed, if they want to get into an appointment and be really prepared, is asking questions. Oh, sorry, Fiona, I don't want to rush us on. Lack of availability of specialists, etc. My mum was in hospital, taken in by ambulance on a Thursday night, had to wait to speak to the right doctor on the Monday before knowing what was wrong with her. That's a big one in Canberra, just a lack of availability. And that time gap can be a real barrier to communication, because you just lose track of what's going on. So there's a lot there that creates these barriers. So one of the things we can do to improve this safety and improve communication is asking questions. There's a reason it's the #1 tip. It does improve a lot of these safety things when you ask the right questions. It prompts health providers to double check things and give you answers in a way that people can process. So the next section is all about asking questions and tools we can use here to mitigate risk and help people prepare for appointments. So I don't know about you. I've come away from appointments thinking, I wish I'd asked this. And of course, with appointments being expensive and rushed, you usually just let it go. What we want is people to go in with as much preparation as possible, or having asked at least a set of questions to get them the information they need. So got a few frameworks to work with. I'll be talking about 3 main tools around asking questions. So this first one is Ask Me 3. Our US colleagues might be familiar with this one. It's a tool that I still keep in my back pocket, because if I haven't prepared for an appointment, if I end up in the emergency room, it's a really good one to have. It's these 3 questions seek the sort of knowledge, skills, and then that last question is around the confidence and motivation you need. So what is my main problem? You're asking for the knowledge to figure out, to know what the condition is that you've got, so that you can go and manage it. What do I need to do? What are the skills I need to manage this condition, or need to go and learn? And that might prompt you to ask, well, can you show me what I need? And then why is it important for me to do this? Well, it might be, well, because it's going to get worse and make you even more ill, could even kill you. Or why is it important for me to do this? To stop you getting sicker later. And that'll give you the motivation. It might give you a bit of confidence. It could prompt you to ask more questions around that. So these 3 questions, really simple framework for people who might have a bit of trouble dealing with some of the bigger lists of questions or preparing for an appointment. Very simple, and it's translated into quite a few different languages if you'd like those resources. I think Penay's just popped it in the chat. So anyone who wants help with health information can use these ones in particular. If you find things confusing at time, you can always fall back on these 3 questions, which is why they're really helpful to provide to just any client who might be going into a health setting. It's really important, though, to still do that foundational work of acknowledging that questions can be difficult, and you still need to support people's sort of emotional confidence in asking more questions and knowing their rights. Does anyone have any ideas about how they might introduce things like these questions tools with their clients? But I'll show you another one because this one's really about what questions you might ask in an appointment, ask of a doctor before you say leaving hospital, if you haven't got a list prepared. This one is about those risk sort of issues that we were talking about earlier in the safety one. So these 5 questions come from a campaign called Choosing Wisely. And it's all about asking your doctor these questions before you get a test, a treatment, which could be a medication, it could be procedure, that sort of thing, or procedures, even big surgeries. And you can use these 5 questions to work out if you're getting too much healthcare, which there is such a thing. So it could be unnecessary, could carry a bit too much risk versus the benefit. Or so that not getting too much healthcare, you're not spending too much money. And so the 5 questions are, do I really need this test or procedure? Because the tests can help you or your doctor work out what's going on. Procedures might help to treat it, but they might not tell you anything, or they might only lead to more tests. And that might be a risk benefit thing for your client to consider. The next one is, what are the risks? Will there be side effects? What are the chances that getting those results won't be accurate? And the, apologies, train of thought. And could that lead to more testing or another procedure? And in some cases, it could be, well, what if I were to get the next procedure instead? Is it going to change my treatment plan? That sort of thing. Are there simpler or safer options? Because sometimes you might be given the option of changing your lifestyle rather than a surgery. And depending on someone's preference, and that this one can really come up to cultural beliefs, is surgery is really not something that they are keen on, particularly people who don't want to get blood transfusions, that sort of thing. Then they might prefer to make the lifestyle changes. What happens if I don't do anything? Some things might go away on their own. Some things can get more serious. And then what are the costs? And the costs, that's where we talk about that financial and emotional risk as well as those physical ones, because financial, there can be a lot of costs with healthcare. There can be emotional things. There could be quite invasive tests. There could be a risk that it could be quite traumatic. And so people need to weigh that up. So we get people to ask these questions so that they're fully weighing those decisions and they can get that informed consent. And the health system isn't always good at explaining risk. So asking these questions helps people understand that risk a bit better. So it's a tool that I really encourage you to explain to your clients. And we have things like wallet cards in the office where people can carry them around. So if you are interested in those sort of tools, we can share them with you, or they'll be linked to like posters in your kit. Are there any questions about this tool, this campaign? Okay, so this one, I will show a website a bit, which is the Health Direct Question Builder tool. You might have come across Health Direct before. It's been used for a lot of coronavirus related things. And Health Direct is a free government website that provide a lot of free health information fact sheets, a lot of medicines information. They also have a symptom checker and a free nurse helpline. So that's another thing that if someone is looking for more health information, they don't necessarily have resources to have another doctor's appointment, a great starting point. Can also help them find more services they might need. And they're 24 hours. So if someone needs help, even if it's middle of the night, this is a great resource to have on hand. So I'll just switch my screen so I can show you. Okay, there we go. So Question Builder, I really like because it takes all that mystery out of asking questions for people. So if we think of Lucy earlier, you could give her a fair bit of support, but rather than doing it all for her, this is a great way to build her skills. So say we've got Lucy and she's going to a specialist. So it's her first visit. And this link will be in your pack. So just we've got a specialist, it's a first visit, go next. And it gives you a whole list of questions that you can choose from. So for Lucy, it might be, why do I feel like this? What caused these symptoms? And could it be anything else? Because we had a really good point there about, well, did the GP check very thoroughly? Then we can go through things like, well, do I need any tests? And what will they show? You can look through, there's, other questions around, how much will it cost? That sort of thing. Treatments. So I think Lucy might want to ask about what are my treatment options, but she might not be ready to ask the rest of them. Don't think she's at the surgery stage. Do I need any new medicines? Might be a good one to ask. What can I do to help myself? Where can I get more support? And the follow-up questions, she can pick what she likes. Hit next on that one. And then she can prioritize the questions. So because we know that there's this time pressure on people, they can pick which ones are really important and click the star next to them. So for Lucy, it's probably why do I feel like this? What caused these symptoms? And I'm just doing an example here. Do I need any tests? Do I need treatment and what are my options? And how will I know if my symptoms are getting worse? Next. And one of the really useful things about this tool, if you're showing it to someone else or helping them plan ahead, is that you can give them an idea or help them think of what questions the doctor might ask. And then they can start thinking about how they might answer those. So that helps them go in with a bit of preparation. So can you describe your symptoms? How long have you had them? How is this impacting your life? Do you have any other medical conditions? Has anyone else in your family had this condition? And what medicines do you take? Just selecting those arbitrarily. Once you've done that, it'll give you your list and you can either email them, and it gives you the option to email it to multiple people, which is really helpful if a supporter is going with them, whether it's someone from one of their support organizations or a carer, email them to a few people, or you can print them out. And the really great thing about these printouts is they have lines under them. So if they've got questions to ask their doctor, I know people who will take this into the doctor and put it in front of them, show them and say, these are the questions I want to ask today. Can you write down the answer for me? And that way they don't have to try to remember. It also means that they've got the questions from the doctor and they can write down what they'd like to say. So it's a really useful tool, particularly where people have those communication barriers or they have issues with their memory. So that tool might be useful for you in your practice. So I'll just switch my screens back. Any questions around Health Direct and the question builder? Oh, I'm glad it'll be useful for folks because, and certainly Fiona, the brain fog factor, it's a really useful tool. I've used it myself and several of my other brain fog friends. It very much helps the planning process without the overwhelm of thinking of these things. Okay. So I will just switch back. Apologies, I've just lost my slide. Okay, so now I'm just going to stop and going to ask you about what strategies you've used to support better communication, if there are any other ones that people should know about, but also how might you use these? So just use that example to apply to Lucy, but how might you share them with her or any of your clients in future? And Oris, that's a really good question. What about really simple language for these ones? It's for me, the Ask Me 3 is what I usually share with people who need very simple language. And there are some easy English versions of that. But I've also added to our resource list a couple of resources from the Council for Intellectual Disability. Has a whole section on health, including preparing for appointments, which is all in easy English for that community. And for people from different language backgrounds, health translations is also on the resource list, which has a massive library of resources in different languages in simplified English too, that you can use. So I will send this all out right afterwards for you. So does anyone have any ideas of other resources that they might share or other strategies they might share with people? Feels like we're all getting a bit on in the day and a bit tired, but very keen to hear if any of you find something later. I'm not sure what you mean, Rosemary.
Just unmute myself. What's sort of been done so far? Who have they seen so far? Just so that, yes, knowing what they've already done and who they're already involved with.
So making sure you've asked about that sort of thing.
Just sort of assess the current situation before sort of going and doing more. That's not a very clear way of articulating it. Sorry.
All good. All good. I think, you know, it's nearly 3 o'clock. Everyone's probably flagging a bit. But definitely good to check these things. But if people haven't got any ideas, it's all good. One thing I do for myself is attach a document like a list of questions and medications to a Google Calendar entry for an appointment. That's a good strategy. That's useful. Or rather like that, especially with things like the question builder where you can email those questions to you. It's a lot easier these days to attach them. Yeah. Otherwise you just lose it, certainly. Some other strategies to support better communication is around helping people to get a supporter to go with them to an appointment. So some community services I know happens less often now with COVID, but used to be able to offer a support person to go with people to health appointments, some of the disability organisations. And that would help people have someone they were already familiar with there to support them with communication where a family member might not be available. As also people, some organisations would help people work out, well, you can get cards from the translating and interpreting service where you can write in what language you need. So if your English isn't that good, you can still have that card to tell people what kind of translator you need, and working that out with people ahead of time so that they have some way of communicating, I need this kind of translator. If they end up in hospital, something like that, they can keep that in their wallet. So there's those sorts of tools. Sienna, so in Texas, you've got community health workers who have strong health literacy and share the same background and language. That's great. Yeah, so having bilingual community health workers, that sort of thing. So if that's available. Another one would be things like peer navigators, and some services have, if those are available. I know that the used to be the Friday Centre, I'm trying to remember the new name, Gender Pathways maybe, that Agenda runs, is that they have those sort of peer navigators to help people work their way through the system and understand how to speak the language of the system. Okay. Right. I'll leave you with one last tool, and I won't talk too much about this because we could go for a while. But there's a tool called Teachback that I mentioned earlier that they teach to health professionals. But recently they came out with another a kind of opposite version for consumers and carers called Checkback, which is where they can check in with their health professionals who might not have learned about the teach back method, which is where you ask a consumer to explain what they've just heard. And a lot of you will have used this technique in reflective listening sort of practice, reflecting back what you've heard to people. Well, it's very much the same thing, but you're asking the consumer to do it. So you might use what is essentially the teach back method when you're giving health information or information about health services to consumers to make sure they've understood you and they've understood what some next steps might be. But you also might share the check back information with consumers and their carers so that they know how to get a bit more information out of health providers. And the reason I share this is because they have their own e-learning modules that you can share with people and access at a later date if you want. And we can also talk about them in one of our other sessions. So I wanted to include those because there's some great resources. They also have some great tip sheets on things like building confidence to ask questions. So I'll leave you with that one. Most of the resources that I've talked about today, yes, they'll be on your resource sheet, but you can grab them all from the Canberra Health Literacy website. So if I toggle over to my browser, I'll just show you a few things that I can show you on there, if it will let me. So the Canberra Health Literacy website was built as part of like a 3-year project for us, and now we'll just keep it up. Has as much information as we can keep up there about health literacy in Canberra. So there's a section for the community sector, which has all these tools that you can share with your clients, but also your colleagues if they want to understand more about the health system, health literacy, and what they can do to help people. So what can community services and workers do, health improvement programs, helping people fill in forms, those sorts of things. So we've got a section on that. We've got information about training that we can offer. So this is really an overview. This is the 2 hours of cramming in as much as possible, but we can do this in more depth over like 6 sessions, tailored to different organizations, depending on what you need. There's also the consumers and carers section, which has more tools that people might need about risk, about informed consent, to help them understand that. And as much as possible, this information is provided in plain English. And we have a built-in screen reader, that sort of thing, to make it as accessible as possible. And there is some translation to the website. So I do encourage you to check that out so you can share it around. And Fiona, I do see that you're asking about peer navigators. I will get back to you via email on that one. So we'll just switch. Okay, so just wanted to make sure that you all knew about that website so you could get more resources if you'd like them, more training for your organisation if you think that would be valuable, and we're always happy to talk about health literacy, health programs, that sort of thing. So those are my details. If you've got any more questions about today, very happy to talk more. And certainly if you're running any health programs that you think should be listed on the health literacy website so people know what's going on, do let us know, because we love to spread the word about these things. Be keen to hear either in the chat or just jump on what's been useful, what's some next steps you might have after today. Otherwise, there is an evaluation form just in the chat there to let us know how we did. So been great to have you all, and I'll be keen to hear what you all do in future in the health space to help clients get the best out of the system. We've got 5 more minutes, so are there any questions about what we've covered today? Thank you, Sienna. Really appreciate it. Well, if there aren't any questions, feel free to jump off. Otherwise, anyone jump in if you've got anything to ask about, not just about this, the work we do, anything you'd like. Cool. And of course, we'll follow up with the recording. Have a great afternoon, everyone then.